Hello, hello, hello. I am Dr. Manon Fielding with Natural Menopause Anti-Aging Solutions, and today we are here to talk about a very important topic that you need to know, and that is the 5 critical things that you need to know before making a decision about HRT. These are the 5 that most of my clients are not aware of, and many women hear and see misinformation on the internet and social media. And so I just really wanted to clear this up so that you can make an informed decision. So, tip number 1, it is not recommended to start HRT after age 60. And if you're over 60 and on HRT, you might want to reconsider and find another way to balance your hormones through lifestyle and natural supplements, because most of the literature shows that after age 60 there are increased risks, and it's not worth taking the risk when there are other options for you. So if you're over 60, consider other options. Tip number 2, take into consideration that if you go on HRT, you want to have an exit strategy within about 5 years, because the research does show that risks do increase over 5 years, and the most important time to be on it is early in menopause. So the strategy is to find an exit strategy, meaning that you're going to taper off, because you're not going to just stop taking it all of a sudden, because then you will have more problems. But you want to think about getting off of it. I hear a lot of women say, "Oh, I've had so much benefit, I'm going to stay on it forever. My doctor said I could." Well, yeah, maybe you could, but it's not recommended, and you have to then be monitored a lot more closely, and your body changes over time. So what really made a big benefit for you 5 years ago may not be the same benefit against the risk after 5 years. Okay, number 3, start as close to menopause as possible. That is when you get the most benefit in terms of symptom relief and protective effect, meaning protecting your brain against dementia and Alzheimer's type of dementia. But apparently women have like 3 times more Alzheimer's than men, and a lot of this has to do with this drop in estrogen close to menopause and having some protection. So the starting early is key here. And if you didn't start early, there are other things you can do. Don't worry. But if you are considering HRT, this is a consideration. All right, tip number 4, estradiol, which is what's given in HRT, that is the most prominent estrogen that gets dropped at menopause. It seems to have similar effects whether it's HRT or BHRT, BHRT being bioidentical, but the body doesn't know the difference when it comes to the estradiol. The synthetic progesterone does seem to be potentially problematic, not for everyone, but for many women. So that is called progestins, and there are several different pharmaceutical names for progestins, but they're all the synthetic progesterone, and they don't seem to have the same benefits as natural progesterone. And so this is something to be careful of. Now, the synthetic is generally given in an oral form, in pill form. So you'll know that. And it is very important to have a balance of progesterone and estrogen in your body. They're not equal, but there is a certain level that is considered balanced that you can learn from testing. And you want to try to get on a progesterone that's more natural. And there are some that we recommend that are great. If you need to know, please let me know. And the last tip, tip number 5, estradiol patches and gels have far less potential side effects compared to the oral, due to the problems that can occur when it goes to the gastrointestinal system and through your liver. Because when it goes to the liver, there are 3 phases of metabolism, and as the estrogen is broken down, there's one type of metabolite that can be harmful to your body, and that's the one that can cause breast cancer. And that's why, 1, being on it for a long length of time, it can be problematic, and 2, depends on your body how you metabolize estrogen, and if you're going in that route more than you should be, there's increased potential for breast and uterine cancer. And that's the reason why a patch or gel, even though some of it may go through the liver, most of it can get excreted differently, and that's why it is less problematic. So I do recommend the patch or the gel rather than the oral. Okay, so let's just summarize here. So if you're going on HRT, you want to start as close to menopause as possible. And we explained that that is a time where you have the most benefit for the first few years, and that it has that protective effect. If you're over 60, probably not a great time to start, and better to find other natural solutions. And plan an exit strategy so that you start on HRT, you are thinking that you're not going to be on it for more than 5 years, that you want to have a transition there. And opt for the patch or gel and not the oral, because like we said, that there is more potential for the breakdown. And I did want to mention here also that if you do a complete test like the Dutch Complete, it will show you how you metabolize estrogen, and that you may have that problematic type of breakdown that can potentially cause breast and uterine cancer, and you actually can know in advance. And there are supplements that you can do to change the way you metabolize. So that's just something to consider as well here. Get the natural progesterone and stay away from the synthetic progestins. So those are the 5 most important things that I found you need to know. So it's important to know your options, because without HRT or something that is similar, you run the risk later in life of cognitive decline and osteoporosis. So there are, however, I did want to mention that there are natural options that have the same protective effects as the HRT, but if you're choosing HRT, these are things to know. It's not recommended to do the natural on your own, because just like we're talking about with HRT, there are a lot of things that you may not know. There's quality differences, there are dosage differences, and you need to work with somebody that has done this before and can look at your specific situation, your history, your body, and make a decision on a program that's right for you right now. Okay, so your present and future health are just way too important. This message was brought to you by the Natural Menopause Anti-Aging Solutions. As I said, I'm Dr. Manon Fielding. If you like this video, please like, comment, and subscribe. Namaste.